Despite the rising popularity of tattoos, their exposure may be linked to an increased risk of cancer. A latest Swedish study has found. The study, published in the peer-reviewed medical journal The Lancet, found that tattooed individuals have a 21% increased risk of malignant lymphoma relative to non-tattooed individuals. The cancer in the lymphatic system, which includes lymphoid tissues and lymph nodes, is called lymphoma, and if this cancer spreads, it is known as malignant lymphoma. This study claims to be the first to provide insight into a potential association between tattoo exposure and lymphoma using a population-based study design with a large sample size. However, the authors have asked for further research to strengthen their findings. According to the findings, tattoo ink often contains carcinogenic or cancer-causing substances such as primary aromatic amines, polycyclic aromatic hydrocarbons, and metals. The tattooing process triggers an immune response, leading to the movement of tattoo ink from the injection site. While pigment deposition in lymph nodes has been documented earlier, the long-term health implications are still unknown. The study utilized Swedish National Authority registers, which covers the entire population, to examine the correlation between tattoo exposure and the incidence of malignant lymphoma and its subtypes. The study included a sample size of...
This was a case-controlled study, which means an observational study that was done in the population, using the data of Swedish nationals. What it means is that it's not a level 1 study. I think it's a level 3 study. So what it has shown is that there is a correlation, there's a positive correlation between exposure to tattoos and the development of lymphomas, otherwise called malignant lymphomas, which are cancers of the lymphoid tissues. What this means is that even though there is a strong correlation, there's a strong likelihood that tattoos cause lymphoid malignancies. Obviously, stronger studies, level 1 studies, randomized control trials are needed to confirm this. But as a wise person or a wise individual, when there is a strong link between an exposure and a disease, I think the wise thing or the right thing to do is to become cautious. We don't want to make ourselves guinea pigs that will be used to prove that there's actually a causation between tattoos and lymphoid cancer. So let's just be cautious. Obviously, higher level studies will need to be conducted to confirm and corroborate these found correlation. But I think let's just be cautious, really.